Good morning. I actually think we're going to start with Marion today, and then I'll come and do my update.
Thanks, Dr. Morrison. Good morning, everyone. The health system continues to work with the Chief Public Health Office in planning and preparing for more vaccinations as both the Moderna and Pfizer vaccines become available to us. Staff are ready and prepared to provide vaccines as soon as we have them available. It remains very important, though, that everyone keep following public health directions and keep the risk of COVID-19 spreading on PEI as low as possible as we move through this vaccine phase. We continue to offer testing at our COVID-19 clinics, and we thank those islanders who are choosing to be tested when they have any symptoms of COVID-19. Testing is such an important step in limiting the spread of the virus, and anyone with symptoms is encouraged to get a test at one of our 5 sites across PEI. I want to remind islanders who require testing before leaving the country for international travel that the process to get your test results can take up to 5 days. So please plan ahead so as to not delay your plans. And as always, and we all know, only essential travel is recommended at this time. We continue to review and update our Health PEI general visiting guidelines that make our facilities among the most accessible in Canada at this time. Individual units, though, do have specific guidance due to the restricted space, and they must be followed for everyone's safety. For those visiting Health PEI hospitals and clinics, please remember to wear a mask at all times, remain physically distanced when possible, and follow specific directions on the units you're visiting. When visiting in hospitals in particular, it's important to follow the guidelines around eating and drinking. We know it's common for visitors to bring coffee or a snack into the hospital when visiting a loved one. Removing your mask to eat or drink is not permitted and can be one of the ways that this tricky virus spreads to others. Anyone visiting patients must refrain from bringing food or drink with them to eat during their visit with a loved one. We also ask that when you do finish your visit with a patient in hospital, you leave directly following. This may feel awkward to some people as you might need to or want to congregate with others in waiting rooms while your loved one is in care. But during this pandemic, the hospital is not a place to gather, and we want to be able to continue to allow visiting within our facilities safely. Please remember that it is important to continue to seek care if you are not feeling well. If you need emergency or urgent care, please go to the emergency department or call 911. Mental health and addiction services are available to you by visiting the bridgethegap.ca website for access to resources on PEI, and you can also call the Mental Health and Addictions Information Line at 1-833-533-9333. Calls are answered to this line by trained mental health and addiction staff and are available from 8 to 4 Monday to Friday. Now's the time for us to really support one another in this leg of our pandemic journey. Stay the course and follow the public health guidance and measures to keep us all safe and our health system supported. As Dr. Morrison has said to us, it won't be forever. I want to thank everyone who's continued with their collective efforts in our system, as well as the public, to keep us all safe during this emergency. Thank you. Dr. Morrison.
Thank you, Marion. Good morning. Today, I'll speak about the update about COVID-19 and PEI in Canada, the easing of public health measures which have been recently announced, vaccine distribution, travel, hockey, and enforcement. So this week marks the 1-year anniversary of the first reported case of COVID-19 in the country, and we have learned much about this virus in the last year. Islanders are commended for making sacrifices and for learning to live successfully with COVID-19 since March of last year, and it has been a challenging time for everyone. As individuals and as a province, we can be proud of how well we are doing to date and for demonstrating why PEI is such a special place, one where people show how much they care about one another at all times, including during a global pandemic. There are no new cases of COVID-19 to report today, and we currently have 6 active cases. Since the pandemic began, we have had 110 cases of COVID-19 with no hospitalizations or deaths. Globally, there are over 99 million cases and 2.1 million deaths. The United States has reached a grim milestone this week, surpassing 25 million cases and almost 420,000 COVID-related deaths. The situation in Canada continues to be concerning, with almost 40,000 new cases and 1,100 COVID-related deaths reported in the past week. Also note 187 new outbreaks in long-term care facilities were reported in this country during the last week of reporting. Last week was a glimmer of hope, though, for Canada, with an overall 20% reduction in the number of new cases of COVID-19. On average, 5,681 new cases were reported each day. Deaths were up 10% in the past week. Hospitalizations were up 8% and ICU admissions up 7%. It is too early to say with certainty that we are coming out of the second wave of this pandemic. The reality remains that Canada is struggling with an aggressive second wave of COVID-19. The daily number of new cases at this time is over 4.5 times greater than the number of new cases we experienced at the peak of the first wave in May, and hospitalizations are 1.6 times greater than the peak at the first wave. We know the more the virus spreads, the more opportunity it has to mutate. The need to slow the transmission of COVID-19 in Canada and elsewhere is urgent. As I'm sure many of you are aware, there is concern about the variants B.1.1.7, B.1.351, and P.1, and the impact that these variants are having everywhere, including in Canada. Effective Saturday, January 23rd, public health measures were further eased in PEI, and this included organized gatherings such as concerts, worship services, and movie theaters can operate with a total of 50 people plus 3 additional cohorts of 50 based on an approved operational plan for a total of 200 individuals. Weddings and funerals can include up to 50 people plus officiants and are not eligible for additional cohorts. Retail stores, markets, craft fairs, museums, and libraries can operate at capacity, provided physical distancing and other public health measures can be maintained, and adherence to physical distancing is important. Gyms and indoor fitness activities where there's high-intensity activities, hot yoga, boot camp, spin and interval training must continue to operate at 3 meters of physical distance between participants. Restaurants and licensed premises can offer in-room dining with a 12 midnight closing time and a maximum table size of 12 people. These establishments are subject to the organized gathering limits. We have heard concerns that some restaurants are crowded and customers and operators are not observing the requirement for physical distancing. We will be conducting additional evening inspections of restaurants in the coming days to ensure compliance with the current guidelines. And note, and I think this is to everyone, if a restaurant looks too crowded, it likely is. We all have a responsibility to make good choices. Do not enter an establishment if it looks too crowded and if physical distancing cannot be maintained. Personal gathering indoors and outdoors continue to be permitted with up to 10 additional people outside your household. Organized recreational and team sports may resume following the organized gathering limits, and personal services can continue as outlined. Finally, and I have been contacted a number of times about this, we know long-term care residents can have up to 2 partners in care and a limited number of designated visitors. But we do look forward to further easing visitation in long-term care soon after all the residents and staff receive their second dose of the COVID-19 vaccine in mid-February. We are in an enviable position in PEI. We are easing restrictions when most other provinces have instituted strict measures to limit gatherings and activities, including lockdowns. We are in this position in large part due to the cooperation, adaptability, and support of Islanders. Residents of this province have shown tremendous respect for the public health measures at every step of our COVID-19 journey. Late last week, it was announced that our participation in the Atlantic bubble is suspended until mid-February. But we will continue to assess the COVID-19 epidemiology and trends in Atlantic Canada to inform our decision on rejoining the Atlantic bubble. I know there have been questions about the possibility of a PI Nova Scotia bubble. Given the COVID-19 situation in Canada, including New Brunswick, and the potential for the variant strains to be a more prevalent and significant concern, non-essential travel outside of PEI is strongly discouraged. While we all yearn for a time when we can travel more freely within Atlantic Canada and elsewhere, now is not the time to leave PEI unless it is absolutely necessary. Now is the time for us to think local and explore our own province. We know from our previous experience and that of our colleagues in other provinces that by the time an outbreak is identified, more often than not, it is too late and the virus has already spread well beyond the initial cases. We have learned this virus is not easily contained and that half measures are not effective. The nature of COVID-19 is that it spreads quickly, and what may initially appear as a small outbreak can quickly become a major transmission event. We see our friends and colleagues in New Brunswick working hard to contain COVID-19 in their province. The situation in New Brunswick is an example of just how quickly this virus spreads and how challenging it is to contain. So just for now, and not forever, it is best for all Islanders to avoid non-essential travel out of province, to seek opportunities to travel within PEI, and to continue to keep our circle of contacts small and maintain our 6-foot physical distance from people outside our households, pay careful attention to hand washing, wear a mask in public places, and get tested for COVID-19 if we have any symptoms, and stay home if we are not feeling well. We continue to be on track with our plan to fully vaccinate long-term care and community care residents and staff across the province and our frontline healthcare workers involved in the COVID-19 response by February 16th. Beginning yesterday, public health staff began administering second doses of the vaccine to residents and staff in long-term care facilities. As of Saturday, 7,117 doses of COVID-19 vaccine had been administered, including 1,892 second doses. The slowdown in the Pfizer vaccine production means we will not receive a shipment this week of our 975 doses. However, we have been advised there will be a shipment of Pfizer vaccine next week, the week of February 1st. And given we have held back second doses of the vaccine, we have flexibility to adjust to missing a shipment of Pfizer vaccine. Our vaccine rollout plan will not be impacted by the disruption in supply of the Pfizer vaccine. We have been advised that we will receive our full allotment of Pfizer vaccine by the end of March. In addition, PEI continues to receive steady monthly deliveries of Moderna vaccine, including a shipment of 1,200 doses next week. We will soon begin immunizing other adults who live in congregate living settings, such as residential homes, group homes, and shelters, as well as Indigenous adults living in communities. Information will be available later this week regarding the process to expedite vaccination for the following key groups: registered rotational workers, registered truck drivers, individuals over the age of 80 living in the community, and partners in care, starting at 1 per resident, and other healthcare workers. Only rotational workers and truck drivers who are registered with our office will be contacted with an appointment time to receive the vaccine. Any truck drivers or rotational workers who have not yet registered should do so immediately by going to the provincial website. In the months ahead, Islanders will be advised about the location of public vaccine clinics and how to schedule an appointment. We ask for your patience and understanding, as it will take months to immunize all Islanders, but there will be vaccine for everyone. The rollout of the COVID-19 vaccine is the most complex and logistically challenging immunization program ever undertaken in this province or in the country. Thank you to our many partners in Health PEI and private nursing home and community care facility operators and staff for their leadership and support during this first phase of the immunization program. I will be meeting with representatives of the Charlottetown Islanders later today to discuss their plan to play league games with teams from Nova Scotia. I do need to be clear that when the Islanders, and that includes players, coaches, and managers, leave PEI to play hockey, similar to PEI residents, they will need to isolate for 14 days when they return to the province. Charlottetown Islander players, coaches, and managers are eligible to apply to work isolate, meaning they are in self-isolation except when attending the rink for official practices or games. They will not be allowed to visit with friends, go to stores, school, work, outside the arena, restaurants, and they cannot leave their property, again, except to go to the arena. When their games or practices are over, they are to go directly home to self-isolate away from others. Anyone who is approved to work isolate must comply with a testing regimen for 14 days during the period of 14 days of their isolation. A negative test does not release them from isolation. There are also no exceptions to any of the organized gathering limits in PEI. They are all subject to approved operational plan, and at this point in time, it is the maximum cohort number of 200 that would be at the arena. And I think it is important to note that any Islanders, like anybody else who is found not following the rules of work isolation, will be charged and will impact the ability of the Islanders to play. Last week, I mentioned that some people do not want to self-isolate and are not following the rules. In the past week, 8 new charges have been issued to individuals for failing to self-isolate and or obstruction of a public health official. Since the pandemic began, 85 charges have been issued with 2 additional charges pending. Failing to cooperate or lying to a public health official is an offense under the Public Health Act. In the event a person is not self-isolating as required, and if that individual chooses to obstruct the investigation in some other way, there may be 2 charges levied. It is best for all involved when people comply with the legal requirement to self-isolate. It is not our wish to issue charges. However, when warranted, and if people are putting themselves and others at risk, a fine will be issued. The vast majority of Islanders, though, have been very compliant with the requirement to isolate. We have been impressed with the diligence and willingness to follow the rules to a T demonstrated by many Islanders. Over 17,000 households have completed 14 days of self-isolation since the pandemic began. Thank you to the many thousands of Islanders who adhered to the self-isolation rules and demonstrated they cared about their health and safety and that of their friends and family. We all feel tired and want this pandemic to be over and for our lives to get back to normal. I'm often asked, what will summer of 2021 be like? And there's no crystal ball to predict what the summer will bring. But I do hope by then we will be able to welcome back family to our beautiful province, albeit in smaller numbers than pre-COVID. I hope we'll be able to continue to gather for events while respecting physical distancing. I hope by summer we will have vaccinated most of our high-risk island residents, subject to the availability of vaccine. I know a lot can happen in the next 4 months that will affect what the summer will be like for all of us. But we have come this far, and now is not the time to let our guard down. We have worked so hard all together and made sacrifices since last March, and please let us not jeopardize that now. We know what works with this virus and what we have to do in order to keep moving in the right direction. We really should try to stay the course and follow these measures. We must protect our province against the importation of COVID-19, and when we have cases, limit the transmission of the virus. Last week, we spoke of gratitude and hope, and we remain grateful and hopeful on this journey. And some days my children and my whole family remind me too that I need to be patient and kind, and I will say what we always say, let us all be patient and kind. Thank you. Et en français, juste avant les questions, just before I take questions, I am going to do a few comments in French. Bonjour. Cette semaine marque l'anniversaire d'1 an depuis le premier cas déclaré de COVID-19 au Canada. Nous en avons beaucoup appris sur le virus durant l'année qui vient de s'écouler. Il faut féliciter les insulaires pour leur sacrifice et pour avoir appris à vivre avec le COVID-19 depuis mars de l'an passé. Ce fut des moments difficiles pour tout le monde. Il n'y a pas de nouveaux cas de COVID-19 à annoncer aujourd'hui. Nous avons actuellement 6 cas actifs. Depuis le début de la pandémie, nous avons eu 110 cas de COVID-19 et aucune hospitalisation ni décès. Depuis le samedi 23 janvier, les mesures de santé publique ont été assouplies davantage à l'île du Prince-Édouard. Notre participation à la boule atlantique est suspendue jusqu'à mi-février. Nous assouplissons les restrictions alors que la plupart des autres provinces ont mis en place des mesures strictes pour limiter les rassemblements et les activités, y compris le confinement. Nous sommes dans cette position en grande partie grâce à la coopération, à l'adaptabilité et au soutien des insulaires. Nous continuerons d'évaluer l'épidémiologie de la COVID-19 et les tendances dans le Canada atlantique pour éclairer notre décision concernant notre participation à la boule atlantique. En date de samedi, 7117 doses de vaccins contre la COVID-19 ont été administrées, y compris 1892 deuxièmes doses. Nous continuons d'être en bonne voie en ce qui a trait à notre plan de vacciner complètement les résidents et les personnels des établissements de soins de longue durée et de soins communautaires et les travailleurs de première ligne qui participent aux interventions contre la COVID-19 d'ici le 16 février. Nous commençons bientôt à immuniser les autres adultes qui habitent dans des milieux de vie collectifs comme les foyers résidences, les refuges et les foyers de groupe, ainsi que les adultes autochtones qui habitent en communauté. Il faut mentionner aussi, seuls les travailleurs par rotation, les camionneurs qui sont inscrits auprès de notre bureau seront contactés pour fixer un rendez-vous pour recevoir le vaccin. Tout camionneur ou travailleur par rotation qui ne s'est pas déjà inscrit devrait immédiatement le faire en allant sur le site web provincial. Et des renseignements seront disponibles plus tard cette semaine concernant le processus pour faciliter la vaccination des groupes clés avec les travailleurs de rotation, mais aussi les personnes âgées de plus de 80 ans qui habitent dans la communauté. L'équipe des Islanders doit suivre les mesures de santé publique. Alors, s'ils voyagent hors de l'île du Prince-Édouard, ils tous doivent isoler pendant 14 jours. Et s'ils font mais ils peuvent faire une application de isoler avec travail. Alors, ils peuvent seulement aller pour les jeux de hockey ou pour les pratiques. Autrement, ils doivent isoler. Et je vais laisser là pour en français les remarques. Et at this point in time, I'll open it up for questions in both English and French.
Danielle Edwards, Canadian Press.
Hi, Dr. Morrison. I was wondering if the province has a plan for the vaccine rollout in the event that the Pfizer vaccine, in the event that there's any more delays with the Pfizer vaccine.
Hi, Danielle. So I think, like the rest of the country, we're watching with interest and waiting for confirmation of our Pfizer vaccines to arrive in the province. And we're also conscious that other vaccines are being looked at in this country, looked at in terms of approval and what that could mean for our vaccine numbers. And we've said right along here, we will vaccinate as many people as possible given our supply, and we will look at extending the interval between doses up to 42 days as per NACI as one other option if we want to at least get first doses of vaccine into as many people as possible. So that is definitely something that we are looking at.
Okay, thank you.
Gabrielle Drummond, Radio-Canada.
Bonjour, Dr. Morrison. Alors, ma question, ça va être en français, bien évidemment. Alors, vous avez mentionné que la santé publique avait remarqué une augmentation du nombre de plaintes concernant certains restaurants qui ne suivent pas tout à fait les restrictions. Ce sont des restaurants qui accueillent peut-être plus de personnes qu'ils le devaient. Alors, quelle recommandation vous donnez aux insulaires s'ils identifient, s'ils voient ce genre de situation-là lorsqu'ils voient un restaurant, par exemple, qui ne respecte pas les mesures?
Bonjour. Alors, en premier, on va avoir plus d'inspections, même pendant les soirs, pour s'assurer que les restos suivent les mesures de santé publique. Et puis, et puis, je sais que les restos ont des plans pour avoir seulement des gens en les mêmes groupes de 50, mais il peut avoir plus d'un groupe de 50, mais il doit garder la distance physique entre les gens et puis entre les tables. Alors, pour les insulaires, s'ils voient beaucoup de personnes et puis s'ils pensent que c'est trop de monde, c'est peut-être le cas. Et puis, pour protéger, eux-mêmes, ils doivent peut-être penser d'aller ailleurs parce que il faut prendre la responsabilité vraiment eux-mêmes de ne pas mettre d'aller quelque places qui sont trop serrées avec trop de gens. Alors, je sais qu'on va travailler avec les restos pour s'assurer que tout le monde est en sécurité.
Parfait, merci. Ma deuxième question, c'est par rapport aux variants de la COVID-19, parce que pour la première fois, on avait détecté ce variant au Canada Atlantique, en Nouvelle-Écosse. Alors, c'est près de l'île. Alors, est-ce que ça vous inquiète le fait qu'on ait détecté ce variant si près de l'île?
Je m'inquiète un peu à cause du variant Nouvelle-Écosse ou n'importe où au Canada, puis parce que ça indique que ça peut arriver n'importe où. Et puis, c'est pourquoi on doit isoler quand on retourne du travail ou retourne de voyage. Parce qu'on sait que ces variants ont tendance de transmettre assez vite. On veut qu'on protège la communauté autant que possible et ces variants inquiètent tout le monde partout au pays. Et on entend de grands nombres de personnes qui étaient infectées avec un foyer de longue durée, des soins de longue durée en Ontario. Et puis, beaucoup de personnes ont été affectées. Alors, on sait que ça peut arriver tellement vite. Si on a des cas positifs ici, c'est envoyé pour voir si c'est un variant.
Parfait. Merci beaucoup.
Okay, merci.
Wayne Thibodeau, CBC.
Hello, Marion and Dr. Morrison. I'd like to follow up, Dr. Morrison, if I can, a bit about, you talked about some of the charges, 8 people charged. We learned this morning from Summerside Police that a 24-year-old Summerside woman was charged. Now, what I found interesting, Summerside Police say that when the woman returned, she advised screening personnel that she was not going to abide by the self-isolation requirements. What do you do in those cases, and can you explain to me why she wasn't turned away at the border?
Hi, Wayne. So I'm not sure I am aware of the details of that particular case. So I can't really comment on what happened at the border. But I think it's really, it's certainly frustrating for everyone in PEI when there are very few individuals, but when they indicate immediately or at any point in time that they do not want to adhere to these measures that are put in place to protect their families and the broader community. We've had over, I think it's 800 proactive drop in enforcement checks for those who are supposed to be isolating over the last 6 weeks. And those, I think, have, been a positive thing in the sense that people realize that there is enforcement there, that people are checking or could check to make sure they are isolating. So I think there's that aspect to it. I think the fact that we have Operation Isolation that calls people to remind them to make sure they're self-isolating, that's a fairly unique thing that we do here in PI. So I think we have, and I mentioned in my remarks, Wayne, we've had so many households who have successfully isolated, and really it's the reason that we are in the situation we're in today is in large part because people have so well complied with isolation in this province and have limited spread of the virus as a result. So, I mean, those are just a few comments, Wayne. I don't have all the details about the particular charge from this morning that you're referring to.
Understand that, Dr. Morrison. Just wondering, though, do you think someone who says blatantly they are not going to abide by the self-isolation rules, should they be turned away?
Well, I think it certainly would flag some questions, and I'm sure it flagged some issues right at the border if that was the case. So it would indicate immediately those people or that individual needs to be followed up. And now we have had people sort of at times indicate to folks that they didn't want to do isolation or they didn't want to, but once they had a follow-up discussion, they did isolate quite well. Sometimes they just needed to be reminded that we are very serious about that in Prince Edward Island, and there's a reason why.
Thank you very much for your time.
Welcome.
Louise Martin, CBC.
Oh, hi. Good afternoon to both of you. Thanks for taking our questions as usual. Dr. Morrison, on the hockey issue and the return to play for the Q League, has the league and have the Islanders agreed to the conditions you outlined, self-isolation or work isolation? And I'm curious how that will work for players who attend school and their billet families.
Well, Louise, as I mentioned, I will be meeting with them at later this afternoon. They have been given the information about what work isolation means, and that means no school and isolating away from their billet families when they're isolating. So I think that will be reinforced. I do not believe they have applied to work isolate yet, so that process needs to happen. But I think... I mean, we have other people who do work isolate, of course, in this province, but it's really isolation except that they, in this case, they will be going to the rink for a game or a practice.
And then my follow-up would be, what about players coming here to play from Nova Scotia? A lot of people have been just wondering, essential travel has been told to be avoided to outside of Prince Edward Island, and how hockey is deemed essential in this case. And then, just back to my original, what about players? What rules will they have to follow when they come to Prince Edward Island?
Well, hi, Louise. There's really two parts. So we have moved a number, I think back in September, trying not to talk about essential workers but we're just talking about workers. So in this case, it was proposed to us that the business of the Quebec League and the Islanders team would be a business, and they would be functioning as a work. And we're not deciding which work is more important than other work. at this point in time. So that's why they would follow all the same rules for having to work isolate. In terms of any teams that would be coming here, anyone who travels into Prince Edward Island also subject to the same type of isolation requirements, and they will all be tested before they play, and they will need to go directly to the arena after testing and leave immediately. So we've told them they are not to mix or go anywhere outside the arena, and they will leave immediately after the game.
Thanks very much.
Yeah.
Laurent Rigaud, La Voix Acadien.
Bonjour, docteur Morrison. Merci pour l'annonce en français. J'avais une question sur les vaccins et les variants. Qu'est-ce qu'on sait aujourd'hui de l'efficacité des vaccins de Pfizer et de Moderna sur les virus anglais, sud-africains, brésiliens?
Bonjour. À ce moment, ce qu'il voit des études à ce point sont que les vaccins sont effectifs contre les variants. Mais ils sont en train de regarder encore, mais à ce moment, ils ont l'air qu'ils sont effectifs. Alors, c'est bonne chose. Et j'espère que ça va continuer et puis on va pas voir les autres variants qui ne sont pas effectifs avec les vaccins. Mais c'est un grand sujet de discussion, bien sûr.
Et j'ai une question un peu similaire sur ce point. À Montréal, je crois qu'il y a l'Institut de cardiologie qui a fait une étude qui dit qu'un médicament, colchicine, je crois, est efficace contre les formes graves de la COVID-19. Est-ce que vous pouvez nous expliquer si ce médicament va être utilisé? Qu'est-ce qu'il en est?
J'ai pas entendu, je pense pas en total, mais est-ce que vous parlez de le ivermectin?
Non, il y a l'Institut de cardiologie de Montréal qui a publié une étude la semaine dernière sur l'efficacité d'un médicament sur les formes graves qui s'appelle la colchicine, je crois. Et je voulais savoir si c'était quelque chose qui était étudié pour être distribué au Canada.
Oui, c'est colchicine. Et puis, j'ai regardé aussi l'étude, mais c'est notre... tous les médicaments qui sont peut-être possibilité d'aider les personnes avec le COVID-19 sont de l'intérêt, mais on va regarder, ça va être discuté aussi avec les autres experts du pays. Et puis, c'est un médicament qu'on a beaucoup d'accessibilité ici, d'accès ici, si on a besoin, si ça devient un médicament qu'on doit utiliser si on a besoin.
Merci.
Okay.
Rachel Collier, Graphics.
Hi. Lots of questions have been answered already, but I guess I'll just go with the stuff that we have available to us now. How many more people can we vaccinate on the island?
So Rachel, we've talked about we started this week doing our second doses of our long-term care residents and community care residents by the middle of February. So that's approximately 2,200 residents that will get their second dose of vaccine. In addition to that, we have our second doses, and in some cases, first doses for some healthcare workers. And I know there's a clinic on Wednesday for some of our healthcare workers at the hospital, and that's mainly second dose as well. And as we mentioned, we have a shipment of Moderna, 1,200 doses coming in next week, as well as 975 doses of Pfizer. So as they come, they will also, appointments are going to be made for the groups that we described. We anticipate an additional dose shipment of Moderna in later in February of another 1,200 doses, plus although we're waiting to confirm, certainly we were given all indication that the Pfizer product and the commitment that Pfizer made to Canada, we would have that allotment before the end of March. So really, we're talking about this Q1, which is from end of December until the end of March, and the groups that we want to do in this Q1. And we actually are trying to pull in some of the groups that were initially indicated for Q2 into this Q1 or this first quarter, so that we can really target as many people as we can, as efficiently as we can.
Awesome. And I guess, so you mentioned, it sounds like next week you'll be getting more, like, would seniors like the age of 80 and adults 18, over 18, living in Indigenous communities, would they start to see vaccines available to them next week, or do you have like a rough timeline on that?
Yes, and Rachel, I'm sorry if that wasn't clear in my notes, but so we are finishing the second doses. By next week, people will have information about the number to call, for instance, or how to book appointments online if you're, or to call for clinics for those 80 years of age and older. And those are clinics that will start in mid-February and till the end of March. Appointments for rotational workers and truck drivers, they will be contacted if they're registered for appointments, again, in that after mid-February and going forward over the following weeks. Those would be bigger clinics that will be held to accommodate those over age 80 and rotational workers, for example. And also we'll be working with long-term care facilities, both private and public, to identify some of the partners in care to start that process of immunizing our partners in care.
Awesome. Thank you so much.
You're welcome.
Dave Stewart, The Guardian.
Good morning, Marion and Dr. Morrison. You've pretty much, I think, Louise, hit on the cue pretty succinctly there. I'm kind of curious, I guess, to further that, whether that same sort of business model definition is also being applied to leagues such as Junior A and perhaps Major Midget, of which teams I believe that would crisscross the provinces. Any thoughts there?
At this point in time, it is not intended for the midget. I mean, I think the only other team that would be considered would be, I guess, the Western Capitals, and so the same kinds of things that we described, Dave, to Louise in terms of, or as I outlined, that eligibility to work isolate would apply to them.
Okay, thank you. And I guess my follow-up would be, do we know how many Islanders are self-isolating right now? Just builds off the question of your comments in terms of those who aren't. Do we know how many Islanders are self-isolating, and whether these people who aren't self-isolating, have they led to cases?
I'm not sure I have the numbers that are, households that are currently in isolation are around 500. Commercial truck drivers, around 800 that have been approved. Rotational workers that have been approved are just around 800. And we have 506 work isolators who have been approved. So they would fall into really the people who are being followed for isolation. So over around 1,000 people who are in isolation at the moment here in PEI. And households, I think I mentioned earlier, households who've completed self-isolation are 17,164, and that includes PEI resident work isolators. And in terms of Dave, I'm not sure. I can't remember. I think you had a second part of your question there.
Just whether or not you talked about those who haven't been self-isolating, the issues we've had with them. Any thought, or do we know if they've led to any new cases?
So I mean, we mentioned it a little bit last week, Dave, that that there have, I mean, since the pandemic began, out of our 110 cases, there have been, since March, some cases where people have been either unable to isolate away from others and may have transmitted and passed on COVID to someone else. And then there have been some cases where they have unintentionally passed it on to somebody else, but they were not isolating the way they were supposed to.
Great. Thank you very much.
You're welcome. Thank you.
Julien Lachasseur, Radio-Canada.
Bonjour, Dr. Morrison. Vous avez parlé en long et en large du hockey des Highlanders en anglais. Maintenant, parlons-en un petit peu en français. Dr. Morrison, en gros, concrètement, pourquoi vous autorisez les Highlanders de Charlottetown à aller jouer au Cap-Breton ou à Halifax? Même chose, laisser l'équipe d'Halifax et du Cap-Breton venir à l'île du Prince-Édouard, alors que vous refusez pour l'instant d'ouvrir une bulle avec la Nouvelle-Écosse.
OK. J'ai pensé que j'ai expliqué avec une des premières questions. Alors, l'équipe des Islanders est vraiment leur travail est de jouer le hockey. Et alors, on permet les autres insulaires, s'ils voyagent pour le travail, d'avoir la chance d'isoler, de travail isolé. Alors, ils ont la chance de faire une application pour isoler, mais sauf qu'ils peuvent aller au travail. Mais à part de ça, il faut rester chez eux, hors des autres personnes. Et alors, c'est pourquoi cette équipe, vraiment, c'est leur travail. Mais il doit suivre les règlements et les mesures de santé publique de chaque autre insulaire. Et tous les insulaires ont s'il doit travailler ici, il doit voyager pour le travail et il peut en faire. Alors, c'est vraiment... c'est pour cette raison. Alors, et puis, c'est pas vraiment un plaisir c'est pas un plaisir d'isoler. Et puis, il faut qu'ils s'assurent que c'est bien fait pour protéger les autres équipes et les insulaires. Ils ne doivent pas sortir de leur maison à partir d'aller au jeu ou pour les pratiques. Ils ne doivent pas voir les autres amis, ils ne peuvent pas aller à l'école. Alors, c'est la même chose pour les autres insulaires.
Dr. Morrison, on parle de 6 rencontres à Charlottetown qui vont se jouer au Centris Link. La première sera le 3 février prochain. Est-ce que, Dr. Morrison, vous allez autoriser des partisans au Centris Link où ces 6 rencontres vont se jouer sans partisans avec des gradins vides?
Alors, le East Link Center suit les mêmes règlements que les autres parties de hockey à Lille. Alors, il faut avoir seulement en total 200 personnes. Alors, ça inclut le cohort des joueurs et puis ils ont permis de 3 autres cohorts. Alors, peut-être 150 en total avec les 3 autres cohorts. Et c'est même si vous allez voir un jeu avec les jeunes moins de 10 ans ou les Islanders, c'est même limite.
Pas de dérogation comme au début de la saison où il y avait 900 personnes?
Et les mesures de santé publique sont mêmes pour tout le monde.
Merci beaucoup.
Okay. Thank you, everyone.